Welcome back to Out and About Today. We're here talking with Rich MacKinnon, Executive Director of the Music City PrEP Clinic, and Rob Sikorski, patient. That's all I'm going to say right now. Rob, tell me this. When you first started taking PrEP, did you feel like there was a stigma? Did you talk about it with your friends, or was it like a little secret?
I actually did talk about it with my friends because I was interested in, as I mentioned, seeing what I could do to help others have access as well. So I immediately started telling my friends, hey, you need to sign up and do this.
Okay, good.
So, yeah.
All right. So let's talk about the broader services of the clinic real quick. What other services are available at Music City PrEP Clinic?
Well, we also provide PEP. So there's PrEP and there's PEP. So PrEP is pre-exposure and PEP is post-exposure. It's kind of like a morning after pill. For people who aren't on PrEP, they do have this as a resource where they think that they might have been exposed. You can come in and get on a PEP treatment.
Is that a short-term thing, or is it for the long haul?
It lasts for 30 days. I mean, yeah, it's a little intensive. Our advice is if you go through that once, you should probably get on PrEP and not go through the anxiety of, oh my gosh, regret sex or more sex, whatever it is, and then have to like show up the next day early and then get on this. Again, it feels more anxiety-ridden, frankly.
Yeah, it sounds like it.
And so you can avoid that and just, again, have the peace of mind of being protected with a simple pill that you take daily without the anxiety. And then the other thing that we're doing now is HIV care. We call that ART care. And so we're another resource in the community. We were mentored and trained by the Vanderbilt CCC. And so we are, if we're not already there, we are on a trajectory to be considered a comparable place. So you have a couple choices in town.
So we talked before we started taping, and obviously we're taping early August. This will be out for a while, but the community looks to the clinic for information on a variety of topics. It sounds like we talked about monkeypox. Tell me, about that. And is it because you've done such a good job with outreach in the community? Is that a part of this, of why the community goes to the clinic for the response?
We are much more than an STI clinic. Obviously, when we've taken on the mission of ending HIV in Nashville, Middle Tennessee, that's a bigger mission than just STI treatment and prevention. So our patients and our community look to us for leadership in sexual health, on a broader level. And monkeypox, while not strictly an STI, is transmissible through sex, just like a cold, pink eye, mononucleosis, and among gay men, it is one of the diseases that seems to be passed around now newly and through close sexual contact or just close contact in general. So we have to be aware of it and ahead of it. My team is on a response to let the community know that we are trying to be abreast of the state of the information for monkeypox, so that our patients and members of the public don't have to do their own research.
Right.
Because that's exhausting and can be frustrating. There's a lot of bad information out there.
That's right. And we're in general, we're lazy people too.
Yeah, and so, we are getting the communiques from the Department of Health and Metro Health and the CDC, and what we're trying to do is distill it and make it available on our website so that our patients can see it as well. And we want to provide then information, in our opinion, what you should do if you think you have monkeypox.
Right. Rob, tell us this. You have choices with your medical care. You could have got PrEP from your MD. Why did you choose to be a patient at the clinic?
Well, beyond what I've already mentioned, it's really the being comfortable to discuss things that are relevant to the LGBTQ community. So when I'm there, I feel extremely comfortable to discuss my own care as well as be able to assist others.
So you're speaking of your experience, and I want to put our viewers, we're going to be showing some videos. If you go to the PrEP Clinic's website, there is a host of videos on their philosophy of service. Rich, why is service so important?
I think service is important because, you know, when you use the word healthcare, care seems to be built in, but it's interesting and maybe a little ironic that bedside manner is distinguishing and differentiating. Like even healthcare providers will make a note like that person has really good bedside manner, as if it's unusual.
Right.
Right. And so what I'm trying to do with our staff is I'm calling it service, and that's why we like to recruit from hospitality and food and bev, because the people that come from those industries really do understand what service means. And so we want to bring service to healthcare, and as a result, it allows us to really kind of step up the experience. And one of the ways that I help patients and our staff think about it is when it comes to an STI clinic, there are literally thousands of cups you can pee in around Nashville. Why pee in ours?
Right.
Right? The cups are a commodity. We all buy them from the same place, right? It's because of the service and the experience. That's why you want to pee in our cups. And that, if you think about that every day, when you come to us, that's the service. That's what makes us different.
I like it. So the marketing arm has exploded.
Yeah.
When you were here a few years ago, I think you had a first billboard in East Nashville.
Yeah.
Let's just talk about Pride, because you didn't miss the Music City PrEP Clinic if you watched the parade or went to the festival. The presence was huge.
Yeah.
Why go that big? And I know Nashville Pride thanks you.
Well, you know, as we have grown our presence in the community in terms of, we needed to grow to support the number of patients we have, first of all, right? So we have almost 15,000 patients.
Wow.
You know, we need an organization with infrastructure to support that many patients. We need the staff to support that. We need the facilities. We have 2 buildings now. We've become a large organization. And in order to support the growth and the mission, we've had to expand our marketing message, the reach of our marketing. Initially, we went after what I would call the low-hanging fruit. So these are the people using social media. They're hanging out in gay bars.
Right, sure.
But now we're on to the next segment of the population that doesn't necessarily go out. They don't necessarily use social media. They're maybe more likely to watch television or see billboards. So we have to go there. Also, some listen to radio. So we need to go there. And those are actually, they're more expensive. It's harder to use data science on billboards.
Right.
You know, but that said, we need to be there. Now, in terms of, you know, why go big at Pride, I think there is an expectation when you are the largest LGBT organization in town that you need to kind of carry the responsibility of that. Pride depends on our sponsorship. So many other organizations depend on our sponsorship. You know, since we've been in existence, we've given over $1 million in grants to other nonprofits.
Wow.
And community partners.
That's impressive.
So, you know, it's just part of the responsibility of leadership, I think. Yeah.
Okay, that's a good note to take a break. But don't go away, because when we come back, you've got to hear about the new location of this clinic. You're not going to want to miss it, and what's next door and next door to it. Stay with us.